While monitoring our kids' overuse of social media is a concern of individual parents, the community, and even the federal government. SouthCoast Health Pediatrician Dr. Blaine Crosland has studied the situation as a doctor and as a mother, and she is here this morning to discuss the importance of setting limits and monitoring the impact on adolescents' mental health. Good morning, how are you?
Great, thanks for having me.
This is such a serious subject. We talk about it from time to time. There's so much out there. We really have to be careful what kids are exposed to.
Yes, I think our Surgeon General put out an advisory last year and then wrote an op-ed for the New York Times earlier this year to let parents know how serious of an issue that this is. I think the fact that our Surgeon General wants to put a black box warning on social media to highlight to parents as a constant reminder this is something they should be aware of.
Yeah, I mean, when it gets that far, then something that should be worth talking about at even the family level, which you do at home as well, don't you?
Yes, I have 4 kids, and so this is something we struggle with on a personal level. This is something I think about all the time on a professional level. It's going to take community effort. When my kids leave the house, they're exposed to social media and technology at school and with friends, and so I would encourage you to be in conversation with your friends, your family, your schools about how we can help guide and protect our kids as they're exposed to something that's not going away.
Yeah, and we were talking earlier, it's not just enough to tell your kids to stay off social media or be aware of what they're seeing in social media, because when they do leave the house, it's a whole new ballgame out there because other kids are seeing things. Correct.
So just because my child doesn't have a phone doesn't mean that one of their classmates doesn't have a phone. And at some point they have to learn to live with this technology, and so it starts when they're very young about why we're not going to watch something, and encourage them to come to you if they see something that makes them feel uncomfortable or uneasy. It's not just about predators. The algorithms of social media push the things that get the most clicks to our kids, and that might not be the safest or the most it's not the safest thing for them to see, even though it might be the most interesting thing.
Right. Your children are young, and
yes.
You said they don't have phones. Do you recommend an age that you should hold off until before you start giving kids phones?
So I definitely would encourage parents to limit smartphones until late middle school, even early high school. It doesn't mean that they can't have an old school flip phone, phones that have very limited programming so that they can't be on group chats, they can't be online. And then social media, that's something that you have to know your kid. It's not, I wish it was just an easy fix, but you have to know your child, and you have to talk to them about, the things that they encounter that might make them feel uncomfortable, and then slowly introduce. Of course, I would never recommend just letting them have it, wide open. You should be in conversation. You should be checking up on them. It's a privilege. It's not a right, and it's something that you need to think about daily.
Yeah. So when the proposal came out from the Surgeon General to put a warning on social media, that inspired you to produce a video out of your Richmond Hill office. How can folks see that and maybe get a little bit more information on everything that we're talking about here today?
Yes. So if you go to SouthCoast Pediatrics Facebook page, you can find the link to that video as well as to the article in the New York Times.
Right. And that's just kind of your thoughts on why it is so important to protect our children and how we can do that with these conversations.
Correct, and just to encourage you to talk about it with the people in your life.
Dr. Crosland, thank you so much for being here today. It really it's great to hear information getting out about this, because it is something that I think we talk about a lot and should talk about a lot.
Thanks so much for having me.
Appreciate you being here.